Our first guest this morning is in charge of the Manchester Health Department, the city that has the most positive COVID-19 cases in all of New Hampshire. Not surprising given the population and the density, but beyond the numbers, there are significant challenges. And when things start to reopen, the city will also need to deal with the daily influx of people for business and recreation. Manchester Public Health Director Anna Thomas, thank you for joining us this morning.
Thank you for having me.
So Manchester is the epicenter of COVID-19 mortality in New Hampshire. First, just give us a sense of what your office is having to do and trying to get out and do on a daily basis in this pandemic.
Yeah, so it's all hands on deck. You know, we're a comprehensive local health department and actually have been in existence for the past 180 years. So responding to infectious disease is something we do every single day. We're currently all hands on deck. We've got staff in 7 days a week working into, the wee hours of the night. And most of what we're doing right now is doing case investigation, contact tracing, follow up with anybody who may be close contacts to index cases. And then we're also working with lots of facilities throughout the city, as well as our healthcare providers, and looking at surge capacity and whether or not we would ever have to activate an alternative care site. And our newest, wave is really reactivating more testing and being able to increase access for anyone who is symptomatic to get a test.
And we'll get to a lot of those topics in a bit here, but I want to focus on this phased reopen that we're going to be looking at in the coming weeks and months. Do you think it'll be safe at any point in May or June for Manchester to sort of see, people back at restaurants, even if it's outdoors?
Yeah, it's really a very difficult thing to predict, and just think we've really been at this for the last 2 months and it feels like a lifetime, right? So even a month from now, I can't even imagine or predict what things are going to look like. We are optimistic that the more that everyone really maintains these community mitigation efforts, that we will get closer to those decisions. But just like on a state level, none of those decisions will be made in a vacuum. They'll be done very thoughtfully. And most importantly, we want to make them in such a way that we're always keeping the public's health in mind and the safety of our constituents and anyone who's visiting the city.
And tell us how you adapt in this environment. Are you going to be able to, say, retool some of your restaurant inspections to be able to look at things like occupancy and distancing?
Yeah, it's an excellent question, and I know this is also being vetted throughout the entire state. And in the city of Manchester, we're very proud to have over 700 food establishments who we license and inspect on a regular basis. And one of the things that we would have to factor in on a local level is whatever is really set in place for standards, we're going to have to devise ways that we can enforce those things. So in some cases, it might require new ordinances that allows us to then go in and inspect these facilities to make sure people are in compliance. And I would imagine this is going to happen throughout communities in the state of New Hampshire.
One place where COVID-19 has been the most frightening has been in these long-term care facilities. And of course, Manchester has definitely been on the front lines of that. Why is the virus so difficult to stop in these locations, even when you get all the resources in there and all the attention on trying to stop it?
Yeah, so what we're learning about this virus is the fact that it really seems to thrive in these environments. So if you just think about it in terms of these are people who are all cohabitating in close proximity to each other. You have healthcare workers and other support workers who are coming in and out of that environment on a regular basis. So a lot of things are being introduced into that environment. And then once it's in that environment, unfortunately, it seems to be really easily spread from person to person. And we're still trying to discover how long it has really been in place. And this is the tough thing that we're even finding when we go in and test in these long-term care facilities, that we have people who actually are asymptomatic and are testing positive. So that's the challenge with this virus is there's a lot that we're still learning on every single day. And I think it is a challenge, even more of a challenge in these environments where things are very close together and there's a lot of opportunity to transmit this virus from person to person.
Are there any steps or interventions at these long-term care facilities that aren't being taken yet that you think should be?
Well, the one thing I have to give Commissioner Chivinette credit for, who's our commissioner of the Department of Health and Human Services, if she came from a long-term care environment. So this was a priority right at the gate. And we also learned from other communities across this country and around the world that this is a highly vulnerable population. So I really want to commend New Hampshire for really coming out in a very strong way to protect these facilities and get ahead of it. So I think there are a lot of things put in place as far as not allowing the public to come in very early on, and then really building up those safe practices within the institutions. And as long as they can maintain that, we really want to stay on course that this does not continue to spread in these facilities.
The homeless, of course, have been a major focal point in Manchester as well. What's the status there? And do you think that's heading in the right direction in terms of making sure those folks have safe access to what they need, while also maintaining the kind of distancing that hopefully they can, but obviously it's a tough population to deal with sometimes?
Yeah, it really is. And I'll tell you, our city activated our Emergency Operations Center actually back in August around homelessness and addiction, because we have been grappling with this for many, many years, not just during this pandemic. So we were already planning and responding to some of the needs of the individuals who are experiencing homelessness. But then certainly with the pandemic, and any threat of introducing cases into a shelter environment, again, I liken it to the long-term care facilities. These are people who are cohabitating very closely. There's not a lot of opportunity for social distancing. There's a lot of opportunity for the virus to spread in a shelter environment. So what is happening throughout the city now is that we are trying to diffuse the population in the existing building, which is Fit New Horizons. And our hope is to spread that population out, potentially up to 3 different buildings during this really peak time of the pandemic. And that'll allow us to build in some more social distancing. We've brought in a lot of safe practices as far as, hand washing and other ways of deep cleaning, throughout the facility. And of course, what has happened too is that people have a fear of staying in a shelter environment, knowing that that could be a potential threat. So we're seeing a lot of folks spill out into encampments in the city. And this is really challenging not only the city of Manchester, but other communities around the state of New Hampshire. So we have a partnership with the state's Emergency Operations Center, with our city's Emergency Operations Center, on how we can support these encampments, which is the recommendation from the Centers for Disease Control and Prevention, to allow them to stay in encampments during the high time of community transmission. So that's what we're in right now. This is a real temporary relationship right now, and we hope that once we can mitigate this on a community level, that we'll start to see people come back into the shelter environment, and we will encourage them to do so. So right now the encampments are just a temporary fix, real short term. We're talking probably less than a couple of months. And in the meantime, what we're trying to do is really prevent the spread of the virus throughout the community.
And winter will be a whole other problem to solve. But before we get to that season, let's talk a little bit about school. Are teachers going to have PPE? What are the plans and discussions right now around September?
Yeah, and again, because we don't know a lot about the virus yet and how it's going to really play out over the summer, and then come fall, like cold and flu season always rises up in our cases. We're still in the midst of those plans. And right now, we have all had to learn, and, I'm a mom as well, who have kids at home who've had to learn how to do the remote learning. And, we've come a long way when you think about how quickly we had to stand these things up as communities. So I'm hopeful that as things seem to calm down and we can really see a decline in the cases, that we can get back to the normalcy, whatever that new normal is going to be for us, and having children in school. I think those decisions as far as what a school district needs to do to ensure safety and really reduce the risk of infection in those environments are things that they actually do quite often during normal times when there's not a pandemic. So they're constantly cleaning schools. They're constantly asking kids to wash their hands. They're asking staff to stay home if they're sick. These are things that have already happened, but I think there's now a heightened awareness going into a new school year. We absolutely are going to have to revisit all of those plans. And just like we're looking at how do we bring businesses back to where they were, we're going to have to look at the schools uniquely to what they need and how can we ensure that the environment is safe for children and staff and families.
If someone in Manchester doesn't have a doctor or health insurance, where should they be going for access to testing?
And again, I love the fact that, we're starting to see some expanded testing happening throughout the state of New Hampshire. So this week, starting on Monday, we are going to be offering testing back at the Manchester Armory, and I cannot thank the New Hampshire National Guard enough for their partnership with us on all kinds of fronts. They've been truly amazing, and I commend them for their service to community and country. But what we're doing now is we're going to expand some testing. You have to be symptomatic, and if you do not have a physician, we want you to call our COVID hotline if you are a Manchester resident. And that number is 668-1547. And we'll be opening up the Armory for appointments only from 12 to 4, Monday through Friday of this coming week. Anyone else who is not a Manchester resident or greater Manchester resident, we're encouraging you to continue to call 211 if you are symptomatic, or call your doctor if you are symptomatic, and make sure you get in and get a test at a lot of this testing sites that are being stood up across the state.
All right, Manchester Public Health Director Anna Thomas, thank you so much for your time this Sunday morning. Good luck in the fight and be well.
Thank you.
All right, and we'll be right back with a look at the fight against COVID-19 in the Lakes region with the mayor of Laconia, Andrew Hosmer.
Go fish on New Hampshire Chronicle.
Welcome back to Close Up. While Laconia has not seen a lot of coronavirus cases, the summer isn't here yet, and it's a community that sees a big influx of tourists when the weather gets nice. With us this morning to discuss plans to handle that and more is Mayor Andrew Hosmer of Laconia. Mr. Mayor, thanks for joining us.
Thank you very much. Good to be here.
So first off, Motorcycle Week, a huge draw for New Hampshire and your city. How confident are you that that can be safely carried off with a delay a little bit later in the summer?
Well, I'm hopefully optimistic, to say the least, but ultimately this is going to be guided by the progression of the pandemic, and it's not. We were faced with bad choices and then worse choices to make in regards to Motorcycle Week. It was clear that we could not have scheduled gone forward with the June scheduling of Motorcycle Week. The worst case scenario would be that it would be canceled this year in its entirety. It's not the best time to reschedule in August. I realize it's inconveniencing a number of people in the Lakes region, but the fact is I'd rather try and reschedule it than cancel it in its entirety. Certainly the influx of people coming from all around the country to Laconia for Motorcycle Week is great for our economy. It's great for the Motorcycle Association. But we have to be really cautious in making sure that our relatively healthy community doesn't become a hotspot because we welcome people from throughout the country.
So many hotels, so many restaurants, so many vacation homes up where you are right now. What's your take on this plan for a phased reopening where we'll start to see little bits and pieces as May and June go on? Do you think that's something that's feasible for you up there in the Lakes region?
Well, I certainly can say there's a demand for it. The economic downturn has devastated some people here, and they're at least anxious, and many of them are downright frightened by the possibility that their businesses will be wiped out. And I think myself and the city council have a great deal of empathy for those folks. But I also believe that first and foremost, it's public health and safety that has to be a priority for us. So in balancing this, the needs of the economy as well as the needs for public health, we have to pay attention to direction from the CDC, from epidemiologists, from New Hampshire Department of Health and Human Services. Really, it needs to be an evidence-based decision. It can't be a politically driven decision, or the pressure can't build up that we overwhelm some of the facts about this virus. That's what needs to guide us. That's, I'm really optimistic that if we do have this, when we do have a phased opening, that it does pay very close attention to what's going on out there in regards to the pandemic.
And I read a staggering statistic in your local paper, the Laconia Daily Sun, there that said a quarter of the workers in Laconia are currently on some kind of unemployment right now. On the one hand, good to know that people are getting that, but on the other hand, it's scary if Washington decides not to do any other kind of relief and that drops off. Are you worried about what could happen to those folks?
I most certainly am worried about that. This is a wonderful community to live and to work and to raise a family. On the other hand, we're an aging demographic. We have pockets of poverty throughout the Lakes region itself, as well as pockets of great wealth. We have an underinsured population. And now, unfortunately, we have a high unemployment rate here. A lot of it has to do with what's gone on at Lakes Region General Hospital and furloughing 600 full-time employees. This has a devastating impact not only on our economy, but also on our healthcare delivery network, which has been crippled because of this. So I have grave concerns going forward, but I am incredibly optimistic about the spirit of our community and their ability to pull together in the toughest of times to overcome some of these challenges.
We'll get to more on LRGH in a second, but I do want to ask you, for the folks down in the southern tier, how real is what we're seeing on Facebook in terms of the influx of out-of-staters to vacation homes and rentals up there?
Well, I haven't paid attention too much of it on social media, but I have heard a number of concerns from folks in the community who are concerned that people are coming into second homes from out of state and not abiding by the guidelines that are recommended by the CDC and perhaps by the guidelines from the states where they originate from. I really think that we're happy to have our residents return to New Hampshire, whether they be full-time residents or seasonal residents. But I think what we really need to do is make sure that people take personal responsibility for their behavior. They need to understand and appreciate and value social distancing. The idea of wearing a mask in case someone is asymptomatic and might be shedding the virus, they need to take that seriously. And I think those are the expectations of people in our community